Hello everyone and welcome to this live Q&A hosted by the Cleft Lip and Palate Association on the subject of the treatment pathway. In this Q&A we will be focusing on the treatment pathway between ages 0 to 18. This event is open to everybody in the CLAPA community, so a huge welcome to you all. Firstly, I'd just like to say thank you to our funders, the National Lottery Community Fund, for enabling this event to happen. My name's Kate and I am a CLAPA volunteer. I have a son who was born with a cleft. Harry's just about to turn 3 next month. I've been volunteering for CLAPA for around about 2.5 years. Today I'm joined by Despina. Would you like to introduce yourself?
Thank you so much. Hi, I'm Despina. I was born with bilateral cleft lip. Have been volunteering with CLAPA for almost 6 years now. Time flies.
It does indeed. Thank you, Despina. We'd also like to welcome Jo, Lucy, Jen, Hannah and Heather, who will be answering your questions this evening. Starting with Jo, would you like to introduce yourself?
Thank you. Yeah, my name's Jo. I've been a CLAPA volunteer for over 11 years now, and I have an 18-year-old son that was born with a bilateral cleft lip and palate.
Thank you. Lucy?
Hi, my name's Lucy. I am a CLAPA volunteer mainly with children and young people, but I was also born with a unilateral cleft lip and palate and have been involved with CLAPA since a very young age.
Thank you. Jen?
Hi, my name's Jen Rundle. I'm a clinical psychologist and I'm with the Evelina London Cleft Service.
Thank you very much, Jen. Hannah?
Hi, I'm Hannah John. I'm a consultant cleft surgeon, last based at Birmingham Children's Hospital.
Thank you so much. And last but by no means least, Heather.
Hi there. So I'm Heather. I'm lead nurse with the cleft team for Trent, which is based in Nottingham.
Thank you so much. And thank you all for joining us today.
Thank you as well to everyone who has submitted a question in advance. If you have a question while watching, please do pop it in the comments and someone from CLAPA will either respond directly or passing on to us. We have had a lot of interest on this topic, so we will do our best to answer everyone's questions. However, if there are any questions that we don't get around to answering this evening, then we will try and get back to you in the chat feature after the event.
Lovely, right, we better get on with the questions. So number one, the first question that we had is, we've just had a 20-week scan and my baby's been diagnosed with a cleft lip. What happens now?
Jen, hi there. So I'll speak from a nursing point of view. Generally, the referrals come through from your obstetrician following your antenatal scan to the cleft team directly to the nurse specialists. The nurse specialists generally will give you a call to introduce themselves, introduce what they do within the cleft team of some antenatal counselling, of information sharing about the cleft and how it will impact your baby, yourselves, and the treatment pathways that we follow. And then many cleft centres will actually come out and do a home visit for that appointment, but it does vary nationally. So do check in with your local cleft teams for what they're doing. Jen, do you have anything to add?
I think the only thing I would add is then sort of next step after that. And I think, again, this varies a little bit, but generally you'll have an opportunity to come and meet the team at some point as well. So you'll be invited to have what we call a cleft MDT clinic consultation. The MDT stands for multidisciplinary team. So that means every discipline is represented in the room. So you'll get a chance to meet one person from each discipline, and it's surgeon-led. But for example, in our team, there was a speech therapist, usually an orthodontist, and a dentist and a psychologist. It can vary a bit, but I think broadly that's similar across all teams. And then you can have a chance to ask any more questions, and usually the surgeon and get to know the team a bit, and the surgeon will explain the pathway in a bit more detail, and certainly you can ask any questions that might be relevant to the different disciplines that you'll be meeting as well.
Well, thank you, Heather and Jen. Let's move to the second question. After recently having our baby's cleft lip diagnosis, everything is a bit overwhelming at the moment, but we would love to know how best to deal with all the complicated emotions. I want to get back to enjoying my pregnancy, but at the moment, the overriding emotion is anxiety rather than excitement.
So I can answer this one. As a mum that had a baby boy with a cleft, I totally understand where you're coming from. I was exactly the same, and that's only natural to feel that way. But on hindsight, which is a wonderful gift, it was a brilliant experience. My baby boy was born, which to me was a miracle. And it's very hard to say don't get anxious, you know, don't get yourself overwhelmed with everything, because that's only natural. But if you had the foresight that I've got now, I've got a healthy 18-year-old causing me lots of trouble, running circles around me, and I look back and I think, what was all that about? You know, you've got a really strong cleft team that will support you, and obviously if Jen wants to join in after this, the psychologist does help you. They're there to help you. So please don't worry. I know it's easy to say that, but please don't. Jen, have you got anything you'd like to add to that?
Thanks, Jo. Yeah, I mean, I think that's all really lovely to hear, you know, other people's stories. And I think I was going to say that it is very normal to feel anxious, and you know, pregnancy can be worrying for anybody, but particularly when you have an unexpected bit of news, like a diagnosis of cleft. So you know, my advice is usually to kind of be kind to yourself, allow yourself some time to process it, and to seek good information from appropriate resources. Use, as you say, the Cleft team, Jo. Use the Cleft team for that information, and CLAPA, because they have absolutely excellent information. There is, as you say, a kind of a really well-established, well-connected, very helpful and supportive community. And you know, once you start sort of allowing yourself a little bit of time to process that news and start connecting and share with other people, a lot of people say how supportive they find that, and they start to make use of all the peer support that's on offer. So do kind of take your time to seek out that information at a pace that feels right. Sometimes just giving yourself some time to sort of think about specifically what information would be helpful, what the things that are really actually worrying you can be useful to sort of kind of simply write things down or talk out loud to someone what it is that's going through your mind can help to just articulate those worries quite clearly. And you know, cleft is you know, it's the most common congenital abnormality, so it's 1 in 700 people. So sometimes once you start talking to other people in your community, you know, your own peer group, sometimes you find actually people say, oh yes, I know someone, or I know someone. So it can sort of surprise people how much information you can gather just from that way, as well as obviously using CLAPA and the Cleft team. So definitely use those opportunities to gain knowledge, because that's really empowering, I think. And you know, if it's okay to admit that you're still worried, even if after some time and getting that knowledge and that peer support, you're still worried, that's totally okay. And absolutely do make the use of the psychology team, because we're very happy to speak to people at that stage and provide support. That's what we're very used to doing. So absolutely don't be worried about asking for more help. That's absolutely, you know, fine, and we're really happy to do that. So and every team has psychology support within it, so make use of that if you need to. I don't know if anyone else has anything else they want to say about that.
No, lovely. Thank you both. Question 3: Are there known to be restrictions on labouring mothers for a baby with being born with a cleft? For example, do you have to give birth in a hospital setting?
Right, I'll have a go at answering that one. I am nursing background and not midwifery, but I have worked with the cleft children and parents for a long time now. So in my experience, we have had home births, we have had water birth, and we've had hospital births. I think ultimately I would say keep talking to your midwifery team, speak to your midwife. Start by speaking with your midwife when you see them locally about kind of what is available, what they know is available to the local area for you, and also speak with them when you go on your hospital appointments. So you're speaking through a midwife, so you're speaking to your obstetricians to ask what's available and ask what support there is. I think some of it might be restricted a little bit if there's any other anomalies. So if anything else has been diagnosed with your baby, because ultimately everybody wants what's best and safe for you and your baby. That's ultimately it. And the vast majority will absolutely be there to listen to what you were wanting and how you were wanting it, and working out how they can work with you to achieve that. So I'd say don't be frightened to ask. No matter how, even sometimes we think, gosh, that's a really daft question. No question's a daft question. Ask it and we can be honest with you with where and thoughts about that. And if sometimes we don't always know the answer as well, but we know who we can go away to and find out for you. So yeah, has anybody else had any experiences on the call that they'd like to share? No, that's fine. Hopefully that'll give you some reassurance.
Thank you, Heather. Now we move to the fourth question. So we're currently navigating the first 3 months before lip surgery. How do you cope with people staring, judging, or even trying to be nice, but it's coming across as pity? It's tempting to stay shut inside for 3 months, but I want to feel proud to show off my baby and not constantly be worried about what other people might think.
Jen, do you want to go first?
You go ahead. You go ahead, Jo.
All right. Well, as a mum, that was a worry of mine as well. Obviously, you've got the protective instincts that kick in as a mother, and all you want is the best for your child. But what you have to remember is your baby won't remember any of this. They're too young to remember any sort of pointing the fingers and comments or anything like that. I think really what you need to do is look at yourself and protect yourself from those feelings, because I used to take it very personally. But when I look back at maybe just a few comments, I never had many. A lot of them came actually from children, and they were just curious. And as you know, a lot of children don't have filters on them. So they would just come up and say, what's wrong with your baby? And if you just gave them an easy explanation, just saying, my baby was born like that and he's going to get a little lip operation soon, they're like, okay, they're very accepting to it. But please, all I can say is don't take it personally, because the people that do stare or point are the people that don't have the knowledge in that field or have never experienced it. So they don't really understand what you're going through. Anything else, Jen, that you would like to say?
Yeah, I think that's really helpful to get, your own personal insights. And I agree with everything you said. I think, it's tough, isn't it? Because you can't, that's one aspect that you can't control. You can't control what other people do or how they react. And, I think you gave a nice example there of children, Jo, not really necessarily having the same filters as adults, and often reactions can be out of just curiosity, noticing difference. It's quite natural to notice difference and react, and sometimes those reactions can be unwanted and perhaps not so kind, and it's from children. Absolutely, I think it so often is not intentionally unkind. It's that they're curious and that they're just sort of surprised and they're noticing something different. we often talk about, and this is shared quite a lot in literature online, particularly on changing faces, and I think on CLAPA as well, we talk about a technique called explain, reassure, distract. So I don't know if you ever came across that, Joe, or anyone else, but it's a really helpful technique. People say it's very helpful just to have a little bit of a structure to think about how they might respond. So the steps being explain, having an explanation, very simply having an explanation, what you can say. And that can vary depending on sort of how much you want to say. You have control, of course, over how much you say and how you articulate what the cleft, what you want to say about the cleft, and how you describe it. So make sure that it's, you can think about what exactly, what sort of different scenarios you might, and what kind of things you might want to say. Something very simple, like, yes, well, my baby was born with a gap in their lip, or something like that. And perhaps even, it might sound a bit silly, but role play it, practice saying it out loud with people, with maybe some people that you're close with, or your family. And I think the changing faces, the literature talks about, you can expand it based on how much meaning that interaction has for you. So if it's a very brief interaction with somebody that perhaps you don't really know very well, or a stranger, you might not necessarily say much or say anything. And then the more you want to share, for example, maybe at the school gates or with other mums that you meet that you want to get to know a bit more, you might say a bit more. And then the reassure bit is sort of reassuring, them and yourself that it's okay. It's not something that we are too worried about, or it's not going to stop them from doing anything. And then the distract bit is the moving the conversation into a direction that you feel that, is away from the cleft. So perhaps talking about something else, talking about whatever else you might want to, or asking them a question, so that you're steering it, you're in control about how the conversation continues on. And then, of course, if you want to share more, as I say, if that interaction means something a bit more, if it's someone that you want to share more with when you feel comfortable, then you can. And I think it is about practice, really, and kind of often people say that the more that they do it, the more comfortable they feel. Using that bit of a kind of graded exposure, it's usually much harder at the beginning, and then little by little, the more and more places and people that you can practice it in, generally people feel a bit more kind of comfortable with doing it, and it feels easier and hopefully less anxiety provoking. Yes, I don't know if anyone else wants to share anything else, but
Can I just add a wee bit?
Oh, sorry, Joe, go ahead.
No, go, Kate, go.
I was just going to say that's something that I certainly found helpful when Harry was born, having a script. As we all know, if you've had babies before, your day can differ depending on what sort of night you've had with your baby, and you may be quite tolerable of people one day and less the next. So I definitely had a script of some sort, that if I did get some looks, they were for children comments and then adult comments, and I just knew what I was going to say dependent on what they said. So that helped me go to those baby classes and take Harry out and just be prepared. So I just think that's the best advice to have, is just have those little sayings and practice them, and you won't become such a mama bear when you're out and want to rip people's eyeballs out.
Yeah, and again, we have in our team, we have developed some resources with these sorts of tips, I guess, and advice for people. So often teams do have things like that, and absolutely psychology again are very happy to give advice around this. It's something that we could talk about quite a bit. So again, you use the psychology team if needed. Thanks, Kate. Joe, I don't know if you were going to say anything else.
Yeah, it was just within the question it said that this individual, this mum, wanted to feel proud of her baby. And I think when I was proudest, and this was before my son Kaelan had his lip operation and I was nervous about reactions, it was with people that knew him, and or people that were very acceptance of change, and they understood what the situation was, and it slowly grew on me. I was always proud of my son, but I think it was when I could see family and friends picking him up, giving him a cuddle, smiling at him, and I'm thinking, I'm so proud of my boy, you know. And so it will come. It, just give it time, you know, and you will be proud of your son or daughter. I'm just saying son because I've got a son, but it will come in time.
Lovely. Thanks so much, Jo. So question 5, I've always envisaged myself breastfeeding my baby. Is this still possible?
Jo, do you have something to start with that answer with, from your own experience?
Well,
yeah, I think that'd be a nice place to start.
I feel as if I'm doing all the talking, so I do apologize. But anyway,
no, you've got plenty of personal experience. It's very valuable.
So I was exactly the same. I envisaged myself breastfeeding, and I've got 2 boys. My first one was one with the cleft, so I hadn't had any experience of having breastfed a baby. So that was like, oh, this is going to be so good. I'm going to feel so close to my baby. I want to feel that nurturing side. But because he was born with a bilateral cleft lip and palate, he couldn't suck. So at first I did. I'm going to be honest with you. I'm not going to feed it. I felt a bit empty, as if I wasn't doing my part as a mother. But as time went on, and obviously we have the special bottles for feeding, you just feel just as close to your baby. You know, it's just the connection that you have and the cuddles, and there's other ways round that by, you know, bringing your baby skin to skin and all the things they tell you to do when you have a baby. So that replaced, I think, the breastfeeding that I couldn't do. I didn't feel as if it had been stolen away from me, because it's just the way it was, and you know, it was just something I had to accept. But it's just trying to find different ways to connect with your baby, I think, and that's what helped me. Just skin on skin and lots of cuddles, lots of eye contact, all those sort of things. It really, really helps. So please, what I'm saying here is, with the breastfeeding, try and have an open mind, because you don't know what your baby will be capable of doing. And when my baby first started sucking after his operations, I was so proud of him. I thought, my son can suck now like everyone else. And, you know, it's just the next step forward, but it was really good. Heather, would you like to?
Thank you, Jo. That was really helpful, I think. There's also the option. So some babies, we always say, we never say never, but it's understanding that mechanism of that feeding for that baby. Babies need to get what we call a negative intraoral pressure. So they need to, excuse me a moment, I'm really sorry, my doorbell's just gone.
Would anyone else like to add to this? Kate, have you got any experience in that field?
I couldn't breastfeed Harry. He was born premature as well, so he was very tiny, and he just couldn't do it. I did try and express a little bit, and he did have a bit of my milk, but I do agree with you, Jo, that I think you have to watch babies that are born with a cleft that little bit closer when you're feeding them anyway. So just having that extra look, that extra stare, that extra half an hour while they drink their milk is just so lovely. And I definitely didn't feel that I was missing out, because with the skin to skin and just having those us moments, and that's what I called it. We had our us moments. I definitely felt as close as I possibly could to Harry. So yeah, it was lovely.
Thanks, Kate. Heather,
Thank you.
All right,
sorry about that, everybody. The reality of having a door. Thank you for that. I think the other bit I was just going to add was, it was about the mechanism of feeding and actually what baby can manage. So learning about actually how baby gets milk out of the breast, or even out of a standard bottle. So therefore, you'll have heard that lots of cleft babies need a specialised bottle to assist them to get that milk. But also remember that babies can still benefit from breast milk. There is expressing. Cleft teams do have the ability to be able to lend breast pumps to enable breast milk feeding. And we will consider babies that are breast milk fed, but from expressed breast milk, to be breastfed babies it's still that milk and they're still benefiting from that. And I think the important thing is to remember is you're a family. There's a you in this as well. So you need to really think about what you're doing for yourself, and you're doing your best for your baby. And babies do grow whatever milk you need to give them. Antenatally meeting up with couples, I'll quite often just suggest to them that they stand in the supermarket and browse the baby milks, just so that they've got a thought of, if they needed to give some formula milk, they've had a thought about actually which brand they might like to use. They're all much the same as buying baked beans from one supermarket to another. They're all baked beans, but sometimes we prefer a particular one over another, and that at least gives you the choice about what you're feeding your baby and keeps that control for you. So all the best with your breastfeeding and your breast milk feeding.
Never thought of it like that. That's a great way to think about it, Heather, so thank you. Right, so we're going to pause the questions there for 5 minutes and just watch a video from Charlotte, who is part of our CLAPA Children's and Young People's Council, and she is going to share her experience.
Hi there, I'm Charlotte. I was born with a bilateral cleft lip and palate, and by the time you're watching this, I'll be 18 years old. So I've been asked by CLAPA to sort of share a bit about my cleft journey so far and some of my top tips for getting through treatment. So I've had 6 operations in total, and I'm hoping to have my 7th later this year, which will be a rhinoplasty to help with my breathing. So the first 2 operations I had were my lip repair when I was 4 months old, and my palate repair when I was 7 months old, and obviously I don't remember those at all, but my first memories of surgery were when I had grommets put in. So I had them twice, when I was 3 and then again when I was 7. And the main things I remember about those were going up to the hospital and doing sort of arts and crafts and word searches with my mum, and not a great deal about the operations themselves, if I'm honest, but I also do remember being told I could have fish fingers and chips for tea, which was my favourite meal when I was 7, so I was quite pleased about that. And yeah, so I had glue ear and a lot of ear infections when I was younger. I've not had as many issues with those in recent years, but I had hearing tests every year up until I was about 14. And the next operation, which is the biggest one that I remember, was my alveolar bone graft when I was 10. And I remember the months leading up to it, I had a brace put in, and my friends at school thought that was quite exciting. And after the operation, I remember being in hospital for a few days, and my hip was sore and my mouth was a little bit swollen, but it wasn't too bad. I do remember eating a lot of macaroni cheese and a lot of ice cream because I didn't really like the soup they had in the hospital. And obviously I was nervous for that operation, and I sort of understood a little bit more. But I went in with sort of a positive mindset of this was going to help me, and I also wouldn't have to do PE at school for a few weeks because I am not very sporty. That experience wasn't too bad. I was off school for a couple of weeks, and I did have to obviously miss school and miss a few birthday parties, which I knew I would have to do at some point, but that was difficult for me, but it was worth it in the end. Yeah, so the next few years were mainly focused around orthodontic work. So I had braces for just over 3 years between the ages of 13 and 16. And towards the end of that time, at the beginning of last year, is when I first got involved with CLAPA through their CLAPA++ mentoring scheme for young people. And that meant that I had someone to talk to who had been through sort of the same experiences that I had and was able to offer me some reassurance and advice, which I really appreciated. Shout out to Lucy. And I had such a positive experience that I decided to join CLAPA's Children and Young People's Council afterwards. And again, I've been able to meet other young people and young adults born with the cleft. We're able to bond over those like shared experiences, and we don't have to like, it's not like the elephant in the room. And that's again really improved my confidence in talking about the cleft, talking to other people in general, and that's the reason I'm sat here today. The most recent operation I had my lip repaired about 9 months ago. That was a bit different for me because I had chosen to have that done. So my advice for sort of like young people around that age, sort of 15, 16, would be, it's okay to ask a lot of questions. I certainly wanted to know quite a bit. And also, you're not alone, and there is support out there and people who have been through that experience. And yeah, my advice generally would be that yes, having a cleft does make you that bit different, and does make you sort of unique. 1 in 700 people are born with a cleft, but it can be a positive thing as well. So I definitely wouldn't be as resilient or as independent or confident as I am now had I not been born with a cleft, and I wouldn't have met some incredible people that I have met today. So it's definitely not something to be ashamed of, and not something to feel like worried about. And yeah, there is always support available when you need it. So that's been my journey so far, and yeah.
We hope you found that useful. Thank you so much to Charlotte for sharing. Now back to questions. What's the best time to take 3D scan picture of the baby in pregnancy?
Would you like me to try and answer that one?
Yes, please.
It's usually the usual process is the 20-week, the one that they call the anomaly scan, because you'll find that you have your 12-week scan, won't you? That checks everything's okay with your baby. And then they have that more detailed scan where they're checking the limb length of baby, the size of baby's head, the heart, they're checking the kidneys that baby's weeing. And that's when they're looking at faces and looking at the cleft. When they, so that's usually done by a sonographer. When the sonographer spots that they think there's a cleft on that lip, they will probably say something to you at that point. Or I think some people kind of find that they nip out of the room and somebody else comes in and has a look at the monitor, and that's then when they tell you. And quite often you're then called back to a consultant scan. Now it does vary across the different teams and the different hospitals about who are doing those scans. So you'll get your consultant scan. But in my experience of where I work, then dependent on the hospital, some couples are asked to go to a more detailed centre so that they can get a more detailed scan of either a 3 or a 4D scan. I think it's normal practice in most NHS scanning areas, to be perfectly honest, and it's usually done from around that 20-week scan. I do know that they say it gets a little bit harder as baby gets bigger, because baby's getting bigger and has got less room to move around. So the actual views for those scans is probably a little bit more difficult for them. But that's my experience from working in the field, but not being an expert on this scanning. I hope that's helpful.
Lovely, thank you. So the next question is, will my baby have trouble feeding or doing normal activities after surgery, and what aftercare products should we use?
Shall I take that one? So after the operation, generally feeding should be continued as before. Now we have to consider that the different operations we're talking about. So lip particularly, they go back to feeding just as before. Often if the anterior part of the palate has been fixed along with the lips, sometimes it's uncomfortable for the babies, but they always given pain relief. And the area is injected with local anesthetic. But the local anesthetic makes it nice and numb, but it also can affect the sense of taste that they have. So they're looking at you bringing the bottle to them, but suddenly it feels really weird and it tastes weird. But generally, the littler they are, they get on with it and they just start sucking because they're so desperately hungry. You've been starving them all day for the general anesthetic, and so they cope well. After the palate operation, what happens is, again, the similar thing, the numbness from the local anesthetic also affects the taste. They will be given painkillers as well, but they often are a little more resistant to trying something because of the pain or because it feels different. So sometimes you've got to try with a smaller teat of the bottle, or you can try with a spoon, syringe. Often by that time the baby's already weaned, so we always advise families to bring, what they like, the favorite packets of food, because the babies recognize them and they think, oh yeah, that I remember that one, I like that one, and they look forward to it. And so even though it feels a bit weird going down the first time because they're so hungry, they just take over. So often they don't like the bottle so much, which is actually a good thing. It'll be a good idea to get them off the bottle by then. And it's completely okay if they don't like the bottle anymore. Just by then, you're encouraging them to use sippy cups anyway. So yeah, so back to feeding almost normally. It takes a few days for them to get back to their normal appetite and their normal sleep cycle and all of that. But it does get there. So often the sleep cycle takes at least 2 weeks to get back to normal. And some of the parents here will have experience of how much it's changed. But activity-wise, you don't have to change anything. You just have to keep trying, particularly after an operation. They refuse something, just try something else, or let them sleep it off, and then when they wake up, just try something more. And they're usually kept in hospital until they're having at least 50% of their normal intake before they're allowed to go home. So generally, we keep an eye on how much is going in with the pain relief, and you get to go home with pain relief as well.
Anyone else wants to contribute to this question before we move to the next one?
I was just going to add that just to my experience from a nursing aspect, don't forget that weaners, they're just thickened fluids. So we generally do count if they've had some yogurt. So even your very small pots of yogurt are 50 to 60 mils, so almost 2 ounces. So it all does add to their fluid. So don't just worry and think, oh my gosh, I've got to get all this great big bottle into them. So all the best with your surgeries.
Yeah, my boy loved custard and Angel Delight. That's how we got him feeding. And he didn't have a problem. He guzzled it all.
Thank you all for your contributions. Next question is, how likely is it that babies or children will need further surgery, such as palate extension or bone graft or something else?
So again, to start with, remember there are separate entities. There's the lip, there's a cleft in the alveolus, which is the upper jaw, and of course the palate. So we're talking about each of this can have the need for further surgery. So if you're starting with the lip, mostly they don't need anything for the lip. It depends on, the type. Some surgery sometimes there's a little bump, or sometimes the symmetry is not perfect, but it's something that we can revise when they're older. Often the nose looks really nice after the operation, but as they grow, the genes that cause the cleft in the first place affect the growth of the cartilage. So the cartilage in the nose doesn't grow as symmetrically and the symmetrical position like the other side. And so again, the nose is something that needs an operation. but again, does not necessarily need it when they're babies. We try and wait till they finish growing because there's often a change with the cartilage. If you try and fix it when they're little children, there's only so much you can do. We try to do some work only at the tip, and we try not to affect the growth of the cartilage. So every time you're going in, there is a risk of affecting the growth. So we try and balance the growth with the necessity for doing something for, the child feeling better about the way they look and that sort of thing. So the lip, that's the nose. Regarding the alveolus, so the need for a bone graft is if there is a cleft or even a notch in that, this child will be assessed at the age of 7, and we do x-rays, and by the time they start losing their baby teeth is when we're looking at whether they need a bone graft or not. So it depends on whether they have a cleft in the upper jaw. If it's a notch, then we just watch and see. But if there's a definite gap in the, when they're born with a cleft that goes all the way through the lip, there's no floor to the nose on that side, nostril on that side, then we know we have to do an alveolar bone graft. And we start assessing them at the age of 7. Sometimes it's just for a checkup at 7 to see how many baby teeth have they lost. If they haven't lost any, okay, come back in a year's time. And then when they're seen, we do an x-ray which checks whether the root of the canine has formed. And when it's nearly forming is when we know it's the right time to do the bone graft. So if you've got a cleft of the alveolus or the upper jaw, then definitely will need bone graft surgery. Then moving on to the palate. The palate surgery, again, 1 in 5 have some issues with wound healing. Now, it can be just that it opens up a bit. If it opens up right after the operation, very often it closes up within the first 6 months. So if it's still there after 6 months, generally it's likely to be there for a while. And that just means there's a connection between the nose and the mouth. And they learn to, navigate food around their mouth. It's usually with certain consistencies of food like chocolate and yogurt, that thick kind of stuff that tends to leak through and come out through the nose. As they get older, they generally learn to control it, so it's not so much of an issue. And fizzy drinks as well can be an issue. This is again something that is corrected or repaired if they want it. It's not compulsory. A lot of people go through their entire lives with the fistula and they're happy with it. But most patients request some, an attempt at closure. Sometimes you attempt closing it and it doesn't heal. And we don't really know why some palates don't heal as well as they should, as well as we want them to. So that's a healing issue with the palate, as well as sometimes when there is that fistula, the body is trying to close it on its own and tries to pull the muscles that have been repositioned at the back, and it tends to get pulled forward. Now, sometimes there's no wound healing issues, but for whatever reason, the palate doesn't grow in proportion to the length of the rest of the growth of the face and the head and the upper jaw and all of that. So we have the palate that's supposed to meet the back of the throat, to make us do sounds like duh, buh, guh, and all that pressure sounds. All those sounds are made when the air from my lungs come out and they go out through my mouth. But if there's a gap and if the palate is not just long enough, not quite meeting there, not lifting in the right place, the air that's supposed to come out just from my mouth also escapes and comes down my nose. If that happens, then we need to do a surgery to fix that, to improve the length of the palate. And that's not something that can be improved just with speech therapy. So that's an operation that needs to be done, and that's what someone's referring to as palate extension, or we call it palate lengthening procedure. We will take some tissue from inside the cheek and fill up the gap in there and push the muscles further back, or we create a bump in the back of the throat and try to reduce that gap that the palate has to go to meet the back of the throat.
Thank you so much, Hannah, for the detailed explanation. If no one else has anything to contribute to this, we can move to the next question. If you notice that a big front tooth has come through the wrong way, I can relate to that. Should you get into contact with the Cleft team? Child is 9 years old, and I think the next stage will be assessment for bone graft.
It's always a good idea to inform the Cleft team, ideally the dentist. Every Cleft team has a pediatric dentist, and so they'll have to have a look at it. So we need to check the position of this tooth. If it's something what we call palatal eruption, where it's in the palate and definitely not in alignment with the rest of the teeth, then it doesn't do any good for anybody anyway. So we'd like to take it out. The pediatric dentist may say, yeah, we'll take it out, or if you're due to have the alveolar bone graft surgery and it's not likely to cause a problem till then yes, you can wait till the alveolar bone graft surgery and it can be done at the same time. Because the child is having a general anesthetic for that anyway. If the child never had, never had many or already had the bone graft surgery, or the bone graft surgery is still a way away, as in it's not imminent, it's still good for the pediatric dentist to just have a look and see, if the tooth cannot be cleaned properly, the likelihood of it getting infected is higher. In which case, just for that reason, they'll have to take it out instead of just waiting till the alveolar bone graft surgery. So it's always best to get a cleft pediatric dentist's opinion on it.
Lovely, thank you. Next question is, do you have any advice on dealing with emotions around my baby's face changing?
I think this one's allocated to me, but I'd definitely welcome sharing, if you're happy to share your experiences, the mums that are here, of what it was like for you.
Jo, do you want to come in?
My experience, I mean, I think it affected me big, because I went in with a baby with a cleft and the lip was done, and I felt as if I was getting another baby coming out. So the way I coped with that, which is my way of dealing with it, I looked into his eyes. Eyes don't change. And straight away there was a connection, and I realized that's my baby. So, don't be afraid of looking at your baby and thinking, that's not what he looks like or she looks like. Just find a way of connecting with that baby again. They'll connect with you probably before you do with them. It's just getting used to the change, basically. But it's like falling in love all over again with your baby. We get it a double whammy.
Absolutely. I think, like you, Jo, I struggled with Harry's change. It's one thing that I am a big advocate for emotions around being a parent of a baby born with a cleft. And I'm not afraid to say that I struggled. I did struggle with his change, but I learned to embrace it. I think it's a grief process, and I certainly went through all of those steps of the grief process, but I think it made it easier because I let myself go through it, and I just accepted that some days are going to be okay and some days that aren't going to be okay. And some of you may have heard this before, but when Harry came out of surgery, I think we'd isolated ourselves for about 7 to 10 days, and we were walking in town. It was the first time we'd gone out, and we were walking in town and he was still forward facing me in the pushchair, and he looked at me and he smiled. And this smile was completely different. He never used to wrinkle his nose, and it was a real sort of wrinkly nose, big smile. And it was like I was meeting him for the first time again. I got really emotional, and I still get emotional talking about it now, actually. But I fell in love with that smile at that very moment. It was like somebody had just shot something through my heart. I mean, I loved him to death anyway, but it was that's when that connection came back, and it was like, that's my boy, that's him, so I think my advice is to embrace the emotions that you're going to feel, and just work through that. Talk to Jen or any of the other psychologist team about that. Use that support, and don't be afraid if other people in your family or your support network don't feel the same. That's fine. Everybody's allowed to feel different, but you can just be open and accepting of the feelings that you're feeling, and know that that is absolutely okay. So yeah, but I'm sure, like you, Jo, you have that moment of, oh, there's my baby, and it is so lovely. Like I say, describing it like when the day that he was born and he was placed into my arms the first time, that overpowering love, feeling. So yeah, that was my experience with Harry.
No, I totally agree, Kate. And I'm just thinking on before my son was going in for his lip operation, I remember turning around to my husband and saying, I don't want him to have his lip operation. I love him the way he is. And I think that was a big, big hurdle for me as well. And I just had to keep, and I remember my husband saying, we've got to do it for him. He's got to, you know, that it's for him. You know, and he was so right. But I always wanted to be selfish because I fell in love with the way he was and his cleft and everything else. So I think I struggled when he did have his operation for a different face. But as Kate said, you know, you do fall in love and it's just lovely. And then their smile's different and it's just really
It's lovely,
nice.
isn't it?
Yeah,
We're a group of mums who are very special in the fact that we get to fall in love with our children's voice.
Yeah.
And
Absolutely.
there's not many people that get to do that. And I think we are so privileged and so honoured. Oh, so privileged and so
you get
honoured
me going, Kate. You're going to get me going.
that we get to experience that and we get to have that. So looking at the better side of the emotions, if you look at it that way, and also take 100,000 photos before your baby goes into surgery. You may not want to look at them straight away, but I now have them on my phone, and I've started to show Harry now, so I'm so thankful for those photos. So yeah, get click happy, click.
Thank you both so much. Sorry to put you on the spot a bit there, but I think that was so lovely to hear your experiences, so much better than I could ever put it. Everything you said were things that I was thinking, and you said way more than that. So thank you so much. I mean, those are sorts of things like feel the feelings, as you say, accept that there's going to be some adjustment, and it's going to be some mixture of emotions, and sort of similar to, I think, sort of dealing with the diagnosis itself. It is a process, and it's, as you say, sort of about recognizing that, acknowledging that, using the support that you have around you, utilizing all the ways that all the people that in your life that you have around you to help you cope with it. And I think I would agree that the photos are just such a nice way of celebrating them, pre-surgery and post-surgery, and such a lovely way to share with them, as they get older as well, that important part of their journey. So yeah, thank you very much.
Thank you so much. So let's move to the next question. How do I talk to my 4-year-old child about their cleft before they start primary school?
Come on, Lucy. You've been very quiet. Put you
Well,
on the spot.
I mean, it's a difficult question for me to answer because, quite frankly, I had no idea I had a cleft until I was quite a bit older. I think for me, one of my first memories of having a cleft, even though I didn't associate it with that at the time, was I had my palate re-repaired when I was just turned 4. And so I very vaguely remember bits and pieces of being at the hospital and having my family come and visit me because, funnily enough, it happened on 2 occasions that my operations fell on my brother's birthday. So I overshadowed him twice. So everyone came to visit me. And one of my main memories that still, funnily enough, stands to this day is I got a Winnie the Pooh balloon, helium balloon, because I love Winnie the Pooh, still do. And that balloon is still inflated at my grandma's house 17 years later, almost 8, it'll be 18 years in October. So I think when you're 4, you don't really know what's going on. You just know that's how your life is. Like, that's how I've always seen it. That's just what I do. I go to school and sometimes I go to speech therapy and sometimes I do this and that. And it's only as you get older that you begin to understand. I don't think my mum, not that I can remember, so sorry if she did, and I feel like I'm making her sound bad, but I don't ever remember having a conversation because it didn't make any difference to my life whatsoever. I think I would have only had those conversations, or my mum would have only had those conversations with me, if there was a real reason that it was brought up. You know, if someone had said something to me at school, or you know, if I was just like looking at myself and going, "What's that on my face?" But to me, it was no different. You know, I'd looked this way since I was a baby. To me, so my face wasn't any different to what I thought a face looked like, and no one around me had pointed it out. So I honestly, I think it's completely up to you what you want to say when you want to say it to your child, whether you want to wait until there's a reason to bring it up, or whether it's something you want to talk about them with early on. I think it is different for every child, but personally, I didn't not benefit, and I didn't benefit either from having that or not having that conversation at that age. I think it's completely different for everyone.
I think you're absolutely right, Lucy. I don't remember having conscious, you know, conversations about my son's cleft at that age, because I just thought he doesn't really, that's his norm. So I didn't really need to. I think I had more conversations about how you feeling about going to school, and just the normal conversations I had with my other son that didn't have a cleft, you know, and just following through from there. And if he'd had raised concerns about maybe looking different, or people were going to stare at him or anything like that, then I would have addressed it, but he didn't, because to him, he was normal. And to me, he was normal, you know, and to everyone else in the family, he's normal. So I don't think at 4-year-olds, they have that conscious bias or, you know, outward thinking of what other people think of them. So I think you're right, Lucy, in what you said. Totally.
And I think, you know, as a 4-year-old, everyone looks different.
Yeah,
You know,
exactly.
everyone, regardless of anything, looks different from everybody else. So that's all, you're just like, yeah, you know, the main thing people would notice about me is my hair. For other people, it might be their eyes. You know, you don't notice these things as much when you're younger. And, you know, like you say, it is your normal. As a person, you know, with a cleft, it is your normal. And it's only probably when you get quite a bit older that you begin to look back on it and go, okay, that wasn't really that normal. Because, you know, not everyone had to, you know, do this every couple of months or whatever. But when you're that age, you know, you're just happily oblivious to the world, and you know, it doesn't need to be brought up unless there's a real reason for it to, I think.
Thanks both. I mean, I would just add that again, there's some really useful advice on both CLAPA websites and also Changing Faces on this, in terms of if you did want to start having some conversations about it in preparation for school. There are often yeah, every family is slightly different. I think you're sharing your experiences is highlighting that I think parents vary in terms of how much it's brought up and how much they talk about it, how much they choose to focus on it. Sometimes people do find it helpful, again, to sort of start to think about just having a very factual, basic, simple explanation for their child that they can start to think about. They might not even be able to say it out loud necessarily, or need to say it out loud very much, but just so that they know that this is part of them. It's not a it's just part and parcel of them. It's nothing to worry about. It's their cleft, and give them some a very simple explanation, such as calling it a gap. I use that descriptive word quite a lot. You know, that you were born with a gap, and it was closed when you were a baby, and maybe that's why you have a little scar, or whatever it might be. Something very sort of straightforward, and is developmentally appropriate for them to learn. And that might be enough, and maybe not. Yeah, maybe not until they're a little bit older than that. But sometimes it can be helpful just to, again, for them to start understanding, oh, that's something about me that's unique to me. But then if it's talked about in a kind of a natural, sort of matter of fact way by parents, then the child usually starts to just think of it as something very normal, and something not to worry about, or sort of attach any shame to it. And then it's, you know, in case, as you say, many times when children go to school, they don't really notice anything, or if they do say something, it's out of curiosity, and then they just have that awareness of what they can say, or they might bring it up, as you say, sort of as and when those comments start, and then you can talk about it a bit more then. So I think it can come up just sort of quite naturally, as you say, sort of as and when those interactions happen, or when, for example, appointments happen, and then it just kind of, there's a natural sort of introduction or a way to sort of then have that little conversation, and then you can get out your photos and you can share those photos of you, you know, of you and of them when they were a baby before and after surgery. We have lots of advice and resources in our team that we share, and we have something called an All About Me book, which sometimes we do with young people, where we have a sort of template with sections that they can fill out, or they can fill out with their parents, and there's sections where they can draw themselves and their family, and then there's sections where they can put in those photos before and after surgery and sort of name who their surgical team is, and then write out that little explanation of their cleft for themselves, but then also other things about them that are special and unique and exciting that they want to share. So I don't know, that they're really great at drawing, or, you know, something, whatever it might be. So it's highlighting the fact that it's part of their journey, cleft are part of their journey, but there's lots of other things that make them unique and special as well. So we talk about using that template with parents sometimes, and sometimes use it to sort of illustrate how you can have those kinds of conversations. So absolutely, like, again, you know, utilize the team support if that's something that you want a bit more help with.
Lovely, thank you so much. So the next question, we are approaching secondary school and my child is feeling nervous about explaining their cleft lip. What can I say to help?
I can go for this one again. I think the first thing to acknowledge about that is that going to secondary school is nerve-wracking for any child. And usually sort of you're going into secondary school when you're about 11 or 10, 11, 11, 12, that sort of age bracket. And for quite a lot of young people, that will be, you know, prime bone graft age, if we put it that way. If you are going to have one, that will be very much around that time that it's all going to be happening. And obviously being that age anyway, everything's happening. So it is a very big jump in many ways, and as you get more conscious of things that are going on, you're gonna instantly think everyone's gonna be looking at me, how am I gonna say it, what am I gonna say? And so like Jen's already mentioned, you know, or like parents have mentioned as well, having a script, almost having a very short, succinct explanation of, you know, what it is, or you know, being very factual regardless of what the comments you have are. You know, it's something that I've spoken to a lot of other young people with cleft about, is how you deal with that transition into secondary school, because it's such a big time for everybody. And regardless of whether there's a comment that's, you know, maybe a little bit more negative, which, you know, any staff at school will probably understand the situation that you're in, you know, with hospital appointments and things like that. So they're always very supportive and, you know, willing to help you with that. Again, speaking to parents as well. But, you know, regardless of whether it's a comment from more curiosity, or potentially a comment that's, you know, meant to be a little bit negative, having one response for everything is a very good way of closing that off. And, you know, it's my life, you know, what else are you going to say, what are you going to do about it, sort of thing. But it is scary, it is nerve-wracking, and if you've already had those conversations, great. Young people at that age are probably more aware of it anyway. I know I certainly was going into secondary school and having lots of orthodontics done. You know, I just got braces, I'd had my bone graft the year before. So, you know, a lot is going on at that time that is very much cleft related. And so that's a really prime opportunity to start that dialogue in a little bit more depth, I think, to be able to deal with, you know, anything that might come up at school, you know, comments from people. But, you know, like having a basic sentence, you say like, oh yeah, like your face form's in and mine just decided it got lazy and just didn't, you know, that's something I would always say to people. It's like, yeah, it got like a bit there and then decided, now, do you know what, I can't be bothered to finish going all the way. And then, like, it's made me more resilient, and I've got to, you know, meet cool people and all this other sort of stuff. So being able to put a positive spin on it as well when explaining it to other people as a young person, I think is a really good way to change the narrative from being like, oh, you've got a scar on your face, what's that? And you're like, it's actually really great. And that's my advice.
Jen, I don't know. Do you want to say something? Because
Um,
I think
yeah.
Lucy's covered it for me.
She, yeah. Um, I think that was, yeah, it was really nice hearing your own experiences. I think, Lucy, I think, yeah, I think it is a nerve-wracking time for lots of young people, regardless if they have a cleft or not. But if you've got that as well, to have perhaps, it's a time where you're naturally going to meet new people, and that could be quite daunting. And to think about all of those many new social interactions with new people. So again, having that sort of a few ideas in your mind, a bit of a script, those things that you can role play and what you can say can be really helpful. We developed as a psychology as a psychology network, we developed a transition pack for this called the Moving Up Pack, which every team has. Which again goes through some of these ideas of sort of how to think about using explain, reassure, distract, how to kind of approach new people and make friends, and sort of tips and ideas for doing that. How to prepare the school as well. Sometimes parents quite like to have a chat with teachers and just ask them what their sort of policy might be if there were any unwanted comments, and what they would do, how they would respond to both kind of curiosity about difference and perhaps unwanted comments about difference, because all schools will have policies and procedures in place, and sometimes it can just be a helpful way to have that conversation to alert them that this is something that might happen, and it would be good to have a bit of a think about how you would respond, what you would do, what you would suggest. Again, I think there's some great resources on CLAPA for this as well on the website. Yeah, I'm not quite sure if there's anything else I can think of at the moment. Hopefully that's
I think as a parent, when Caelan was going into secondary school, he didn't come to me. He didn't say there was anything he was worried about. But I sat down with him and I said, listen, you want to talk to me about going to secondary school, how are you feeling about it? Obviously, you're going from a small school to a super school. There's going to be a lot of people there that won't know you. And my son's very laid back. So he was just like, shrugged his shoulders. He says, I'll be fine, Mum. And I says, well, I just want to let you know I'm here if you ever want to talk to me about anything. And it doesn't matter what it is. It could be anything. So it's just kind of making sure that they know they're supported well by a parent. I think as a parent to a parent, the advice is just make sure that dialogue's always open for them, so they know to come back and share whatever they want with them. But I've found over the experience of being a volunteer with CLAPA for 11 years that every person, child and adult, that has a cleft, they're so resilient, they're strong people, they're amazing people. And I'm going to get quite emotional because I've got one at home. But, they all do really, really well. And as a parent, you worry and it's going to happen, but just keep that dialogue open with them. That's the only advice I can give, I think, because I was very lucky with my child.
Thank you so much for sharing your experiences and your advices. Moving to the next question, we have a parent who is asking an advice on dealing with, or maybe a child or a teenager, on dealing with unwanted comments from people at school.
I feel like I'll go first again for this one. This sort of feels like my little my little section. The first thing I would say is it very much along the lines of what we've already just said, but understanding it yourself is the best way to explain it to other people, because as we already established, comments that are unwanted might just be because people are nosy half the time. It is something that people will probably at one stage or another will probably notice and will probably want to ask about. Being a young person with a cleft, one of the biggest things for me that made that whole experience a lot less lonely was being a part of CLAPA. Like, I cannot shout loud enough from the rooftops how much being a part of CLAPA over my development as a young person made such an impact on my on my life and my own perception of having a cleft, because I think your own perception is very much going to shape how you see other people's comments. And not to, toot my own horn again, but myself and a few other young people with cleft are the mentors on the Cleft Plus Plus scheme. And the whole reason we wanted to establish that as a thing for other young people was to deal with exactly these sorts of questions and making them feel like, it's a normal process, and let's talk about it as people who relate to each other. So the sooner you can connect to that community, whether it's through CLAPA or through, people that you might be sat next to in the waiting room when you're at an appointment, building that community and knowing there is at least one other person out there that looks like you. You know they're there, but you don't see them on a regular basis, even though it is the most, common facial ambiguity or whatever thing that happens. You don't see it on a daily basis. So connecting yourself with that community as soon as possible is a really good way to reshape your own perspective. I think, unwanted comments at school, again, it's sad to say, but they are a thing that happen to any young person. So it's all about, feeling strong enough in yourself that you can answer that in a way that makes you feel comfortable. I think if it's a comment that's unwanted and you want to talk to a trusted adult or whoever, go for it, do it, because that's exactly the right thing to do in that situation. But if you want to respond with actually, this is what it is, or if you just don't want to respond at all because they don't need your response, you will have your own ways of dealing with it as a young person. My way of dealing with it personally was going, actually, this is what it is, this is why I have it, and what you're going to do about it. Sometimes the more attention I'd give to it, the less people would ask questions, because A, I'd answer them all, and B, they were like, well, we're not going to get the response we want from her, are we? So let's just leave her alone. Which is, a very nice thing. But I think also unwanted comments can come from, if you're missing school sometimes for appointments and different things like that. So always address sort of what the context is for what they're saying, I guess, and deal with it in a way that you feel comfortable with. But ultimately, if you know that there are other people out there like you and you have a sense of community and you feel confident about it, then it's easy to say, it's less harder to practice, in reality. But if you are confident in your cleft, then, what does it matter what anyone else says or thinks or whatever? It really doesn't matter. If you feel happy about the way you look and you feel confident enough in yourself, then anyone else's perception, quite frankly, they just don't matter.
That's lovely. That's great. That's such a lovely answer, Lucy. Thank you so much. And you touched briefly on it in your answer, but the next question is, will my child's education be affected if he needs different surgeries, meaning extra time out of school?
Seeing as I was just talking about it, I might as well lead on from what I was already saying. So obviously, as a young person, you get used to going to the hospital more regularly than other people do. And the first time I noticed that as what I thought was a negative thing was when I was preparing for my bone graft. So primary school, I was in about year 5. And we had a parents' evening or whatever, and I'm looking through my report and it's green, 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 green. And then there's a big yellow blob on the attendance marker. And I go, but it's not my fault. And my mum's there being like, it's not your fault. Don't worry about it. It's silly. It's a silly thing they do. And I suppose that does really stick with you because, people are out there getting 100% attendance certificates every other month, and you're there like, I can't do that and it's not my fault. Although, funnily enough, I'm looking at my wall and the one I did get when I was in year 10 of secondary school is literally stuck there on the wall. But I think that's a big thing because you're never recognised for that. And I think that personally is a wrong thing from schools to do, to make you feel ashamed of not being there 100% of the time, because even if you're there 95% of the time, you could still be giving 100% effort. So it's a silly system, but that's not the point. I think it's very good when the school already understand, and particularly when I was in secondary school, I had quite a lot of orthodontic procedures. And funnily enough, when I was at the hospital once, there's a school and they sent my attendance off to my head of year when I just started secondary school, and she emailed my mum being like, "It's really great to see you're in school, Lucy," whereas I was just colouring in, you know, before going into surgery. But I think your education, it is what you put into it, is what you get out, and there will be things that you miss, but it's about making sure that the school are aware and teachers are aware of why you're not there and that it isn't your fault. And you know, holding them accountable, that they make sure that you can catch up in good enough time, or that you don't miss out on things, you know, or that you're not punished for missing out on things when it's really not your fault. I think, you know, us young people with cleft have resilience that other young people necessarily may or may not have. Personally, the young people with cleft I've met tend to be more resilient. And so we bounce back a lot quicker, and we, you know, get stuck into things because, you know, we've been through a lot by the time we're 11 or whatever it is. So you're quite used to, you know, having to, you know, shift up a gear and crack on with stuff because that's just what you're used to doing. But I think it's really important that whatever, you know, educational environment they're in, are very aware that, you know, if they're missing, you know, every Friday, every 6 weeks because they're having their braces tightened, that is not their fault. They have to have that done, and the school need to make sure that that is, you know, made up for in one sense or another. That isn't like a punishment for the young person, because I would have it sometimes where I'd miss a biology test and I'd have to sit and do that in my lunch break, which meant I didn't get a lunch break, which isn't necessarily the best way of doing things. So it's about coming up with a plan for that young person that's going to work for them and make sure that they don't miss out on anything that happens. But usually young people with cleft are quite determined. They have a lot of grit. So you don't need to worry too much about, you know, if they're missing a couple of hours every 6 weeks or whatever it is, because, you know, we're strong and we crack on and we get it done. So I'd try not to worry too much. But if you are worried, speak to education, speak to your team at the hospital or whatever, and they'll reassure you that every cleft child misses school at some point, and we all turned out great, so I really wouldn't worry too much.
I mean, as a parent, I worried about my son's education because of the amount of time out of school with his operations and everything. But looking back, great hindsight again. I think, well, with most of his operations, they were done when he was in primary school, and obviously had his bone graft as well. And obviously now he's not had as many. He can have some if he wants to, but then not, he doesn't need to. So the latter part of his schooling and education, when he really needed to be there, he was there, you know, and it was more, I'm not saying primary school is not important, but as they get older, obviously education becomes a lot more important on the subjects and the journey that they take. And his operations weren't affected as much in that period of his life. I mean, he's left school last year. He's got a brilliant job, and I'm so proud of him. He said, "I don't want to go to uni, Mum. I want to go and get an apprenticeship." He's an engineer, training to be an engineer. He's doing fabulously. And he worked really, really hard towards the end of his schooling. And there wasn't much disruption with operations. So I don't think personally the operations that he had for his cleft affected his education, because it was the latter years when it was important. I think it was more an emotional thing, because he hated having to go out of class to go to an operation because it made him feel different. And I think that's the emotional scars maybe, and what Lucy was saying as well, on how you dealt with that. But the educational side, it wasn't affected. That's just the mother's point of view. That's how I look at it. Jane, have you got anything to add to that at all?
I mean, I guess I would just add that generally, if you're concerned, again, talk to the team, because these are planned surgeries. You know, there's a time period where that you'll get given notice, and you usually broadly, I think, you know, we can fit it. We can sort of change timings a bit if there is a key part of school that you're worried about, or exams or something like that. So again, share your concerns if you're really concerned about missing key parts, any key parts of school. And the other thing I was just going to say was that for things like, I mean, obviously seeing the team for orthodontic and dental appointments, it has to be face to face. But for things like psychology appointments, that sometimes for speech appointments, they can be done online. We can try and do them at the end of the day, after school time, sort of after you finish school and things like that. So there is some flexibility in the system there as well if you're worried. So again, just ask if that's possible.
So my next question is, I don't know whether Jen and Lucy, you want to jump in with this. My son is 15 years old now, born with a cleft lip and palate. He's had 3 surgeries so far, but he's challenged with low self-esteem. Is there anything I can do to support him?
I think just being a parent is the baseline thing I could say. There are quite a lot of times during, secondary school period in particular, so about the age of like 14, 15, 16, where as you become more aware, you become more self-conscious. Again, natural with that age, but I feel like when you have a visible difference, you do notice it more and you do feel it more personally, because at the end of the day, it's something you can't really help. And so I think from the perspective of like looking at what my mum did for me, is just listening. When that dialogue is there and they do want to open up and talk a bit more about it, just listening. But even if they don't want to talk about it, you still, as a child, when your parent is there. I always knew that my mum was there if I needed to talk to her about anything. And sometimes you don't want to, but just knowing there is someone there makes you feel safer. I think in terms of self-esteem, again, as I've mentioned already, trying to surround yourself not just with people with a cleft, but people that are like-minded, people that you have common interests with, and trying to find a little sense of like friendship or anything really that makes you feel a little bit less lonely. And that's different for everybody. It could be that you find a hobby you really enjoy, or a sport that you really like, or anything pretty normal in your life that just makes you feel more confident in yourself, or just a little bit, happier, or gives you something to look forward to. And for me, that was maybe coming home and watching a bit of Netflix just to take my mind off things. It's different for everyone, but self-esteem, I think, is a really difficult issue for anyone at that age. And I think, in encouraging your child that there is a space they can talk if they want to. Again, CLAPA have some really awesome services for young people for exactly that purpose. They're not as formal as maybe going to see your psychologist if that's something that they're scared of. But again, the psychologist and the rest of the team are there to support. If there is someone you want to talk to, it might not be the psychologist on your cleft team. You might have a really good connection with your orthodontist or your surgeon or whoever. So there's always going to be somebody out there that you might feel a little bit more comfortable to open up with. And so I think helping them understand that doesn't have to be you as their parent. It can be anybody, just as long as they are talking to somebody at whatever point they feel ready, or they are doing something that is going to take that negative emotion away and help them concentrate more on something a bit more positive. I think is quite important. But again, knowing that it is actually something that the majority of us will go through at some point, particularly during the teenage years, and that it isn't just you, I think is a really, really big thing as well. Like the majority of us young people with a cleft have felt pretty self-conscious at times, or look back at things and gone, oh, you can really see my lip in that one, yikes. But actually, looking at it and having the symbolism of it, well, it's everything that you've been through, it's everything you've overcome, trying to put a positive spin on it where you can, that makes you feel like actually that's like a mark of everything I've achieved in my life. At the age of 15, you've already been through twice as much as your peers probably have. So yeah, seeing it as a positive thing and as a mark of your resilience and your courage and all of that sort of stuff is how I've perceived it over time. And I think that's what's helped me, grow my self-esteem and be able to talk more widely and whatever about what having a cleft is like for young people.
Thank you, Lucy. Jen, did you want to jump in or?
I mean, I think that covers
Yeah.
everything I was going to say. That was very thorough. Excellent. Thank you, Lucy. Yes, I think all of those things are very important. Again, as you say, open dialogue. That's what I would certainly be talking about. And I totally agree about the idea of trying to foster those kind of positive relationships where you can. So thinking about what maybe they are interested in, and if they're struggling maybe with peer relationships or finding that sense of confidence at school, just think a bit more broadly than that. Is there another area, club, hobby, as you say, that they like a bit, or is there something new that they could maybe try? And talk to other parents. What other things are people doing? Is there another, something else that they can maybe get involved in, and just start to develop a little bit of confidence gradually over time? And those kind of positive relationships are really important. But yeah, and as I say, and as you said, Lucy, make the most of the peer support and the psychology team and the other members of the team as well.
Thank you so much. I'm afraid that's all we have time for tonight. If you would like to provide us with any feedback, please do. There will be a link in the chat, and there will also be a link provided to CLAPA support services where you can access peer or parent support, the CLAPA counseling service, and our Cleft mentoring service. If you have been affected by anything discussed this evening, please do reach out for support through your GP, local NHS Cleft team, or email us at info@clapa.com.
So some very important thank yous. Firstly, thank you so much to Jo, Lucy, Jen, Hannah and Heather for giving up your time to answer all of those questions. And Charlotte for sharing her experience by video. It's hugely appreciated, and I'm sure everybody watching feels the same way. Thank you as well for everyone who has joined us online. This video will be available on CLAPA's Facebook page straight away, and a subtitled version will be posted on the CLAPA YouTube page as soon as possible. And of course, a big thank you to you, Despina, for taking your time out to volunteer as a host this evening.
And a big thank you to you, Kate, for also volunteering this evening. Lastly, we would like to say thank you to our funders, the National Lottery Community Fund. This has been a really interesting event. If we didn't get around to answering your questions in the chat, remember you can get in touch anytime at info@clapa.com, where CLAPA staff can help and point you in the right direction. We hope you have enjoyed the Q&A and that we will see you again at one of our upcoming online events in the future. From all of us, good night and have a lovely rest of the week.